Hello there. My name is Dr. Gabriel Ehrman, and I am the Program Director for the Transitional Year Residency program here at Mercy Catholic Medical Center. First off, I would like to thank you for your interest in our program, and I'm looking forward to telling you what our program has to offer. We are a community hospital who is also a safety net hospital for the population of South Philadelphia and the surrounding communities in Delaware County. Our transitional year program is one that is well balanced in order to give you a solid foundation in clinical medicine that will take you through your residency and your career as a physician. Because we have osteopathic recognition, you will not only fulfill the requirements for your osteopathic license in states such as Pennsylvania and California, but we will foster your skills in osteopathic manipulative medicine in both the inpatient and outpatient setting. We are a competitive program. For this year, we will be matching 9 positions. Our graduates tend to enter into PGY2 radiology, anesthesiology, physiatry, and more. In speaking with our graduates, a common theme arises. They were more than adequately prepared to meet the challenges. Some of our past interns recommended to their medical students this program. It is felt that the foundation that we provided them was not only solid, but they felt better trained than some of their co-residents. This program has a rich and long history. We have been training both allopathic and osteopathic physicians for more than 40 years. As mentioned before, our osteopathic recognition will satisfy the requirements by some states to obtain your osteopathic medical license. This hospital also has a preliminary internal medicine year, and what makes us different is that our program can be customized to meet your needs of future training goals. As a transitional year resident, you will be training at both Mercy Fitzgerald Hospital and Hub Cedar, formerly Mercy Philadelphia, as well as a primary care clinic at PCOM. All of the sites will not only give you a strong foundation in bread and butter medicine, but you will also be seeing pathology you thought you would only see in textbooks or board questions. To give you an idea, according to the CDC, Pennsylvania is number 3 in the United States in the number of malaria cases, with Delaware County being one, if not the highest in Pennsylvania. This is because of the large number of West African citizens who return from visiting friends or family. In addition, because the population tends to be low socioeconomic and the lack of seeking out health care, the pathology that our patients present with will generally be advanced. This allows for an excellent clinical environment while treating those that really need you. Trinity Health is made up of 93 hospitals. MCMC is part of Trinity Health Mid-Atlantic. There are a total of 97,000 employees and an annual revenue of $15.9 billion. Mercy Fitzgerald Hospital was established in 1933 by the Sisters of Mercy. It is a 275-bed hospital with an 18-bed combined MICU, SICU, and CICU. The ICU is a closed intensivist model with an overnight tele-intensivist service. The ICU services post-CABG patients, and we recently signed with a new neurosurgical service. We have continuous EEG monitoring as well. In addition, our cardiac cath lab will do intra-aortic balloon pump as well as Impella. So what does this mean for you? It means that we transfer very little to other facilities. You will be able to treat patients with complex medical conditions. There are no fellows in our program. This means that our residents and interns will see all of the patients, they will interact with all of the specialists, and perform most of the procedures. Outside of the ICU, there is a large teaching hospitalist service with resident teams made up of 1 senior internal medicine resident and 2 interns. Those interns can be a mix of transitional year, preliminary year, and categorical internal medicine. This means that you are part of the team and not just a TYR. The hospital provides a wide range of comprehensive healthcare services to the surrounding community. This is a photograph of the original building from the medical office building where many of our attending physicians have their practices. And this is an aerial view of the entire campus. As you can see, we have the original building, the new building, and the medical science building. The Cedar campus of the Hospital of the University of Pennsylvania is formerly known as the Mercy Philadelphia Hospital. After acquiring the hospital, HUP and MCMC entered into an agreement where our residents and interns remain to provide medical care for the population under the auspices of UPenn hospitalists. The citizens of West Philadelphia are of very low socioeconomic status, with very poor medical literacy and very advanced pathology. The rotation will expose you to the urban environment and the medical issues associated with the people who live in those areas. We are very proud of the accomplishments that our residents in this hospital have achieved. Each year, you are required to participate in scholarly activity. Some of the projects can range from reviewing appropriate admission orders to ensuring that transfers run according to protocol. Our residents have placed in the top 10 in the region at patient safety and quality forums. In addition, MCMC has been in the top 5 performers of all hospitals in the Trinity system and in the top 10% of all U.S. hospitals. In 2014, our ICU team performed cutting-edge research on the importance of sleep in the ICU to reduce the risk of delirium. This research was featured in both local and national news outlets. The hospital achieved the designation of being a bariatric center of excellence and is playing a leading role in the fight against the opioid epidemic in our region. It's a requirement that all transitional year interns do a 1-month rotation in the primary care clinic. This is done at the PCOM Primary Care Clinic off of City Line Avenue. It is a state-of-the-art facility that was opened in 2011 and is a medical home model that is only 15 minutes from campus. A typical schedule for a member of our transitional year class includes 4 to 5 blocks of internal medicine, 1 block of internal medicine night float that is divided into 2-week sessions, 2 blocks of medical ICU, 1 block of emergency medicine, 1 block of ambulatory primary care, and then we give you 4 blocks of electives. It is these 4 blocks of electives that allow you to mold this residency to the experience that you want to have. This is an example of what the rotation schedule looks like when you take into account that we utilize 13 4-week blocks. As you can see from these choices, you can make this internship what you want of it. With the current state of things in a new world of COVID, some rotations may not be available. This would be because of social distancing requirements or the specialty has become completely telehealth. As the situation with the pandemic changes, I am always in contact with the rotation directors to see whether or not there are any changes or if the elective has opened. During your week of orientation, you will be participating in our clinical skills workshop. In this workshop, you will review the basics of procedures such as lumbar puncture, central line insertions, ultrasound-guided IV insertion, and more. Of course, when you get to the inpatient setting, you'll be able to perform these procedures hands-on while under the supervision of a senior resident or even the attending. You can do as many or as little procedures as you want, but you need to keep a log of them during your internship to show your PGY2 what your skill set is. Not only will you be learning at the bedside, but you will have plenty of didactics. We have modified our didactics to comply with social distancing requirements by both Trinity Health and the state of Pennsylvania. Our lectures are done through Microsoft Teams, and there is a distance learning component as well. The didactics are designed for you to be able to use the information at the bedside immediately and not just to get you through boards. If you have an interest in research, we have resources. We have a centralized IRB and will be able to perform clinical research with a faculty member. You can even have a clinical research month as an elective. However, there is one caveat. You must have your IRB approved before starting. That way you have the entire month to be able to do your research and collect data. This year, 4 of our interns are taking advantage of this elective. Some past research projects include the quantification of opiate use in post-knee replacement, education of radiology residents, and treatment modalities in physiatry. Our interns have even presented at national conferences, so you have plenty of opportunities. Our interns are evaluated in a 360-degree process, meaning they are evaluated by their senior resident, their attending, and the nursing staff. This allows us to better train you for the future of medicine, which is more interdisciplinary than ever. These evaluations will provide you with a foundation by finding areas of improvement early on to better train you as a team leader in the future. You will meet with the program director once a quarter to review your progress, and a letter with the progress goes into the file. At the end of the year, a cumulative report is sent to your PGY2. We utilize my evaluations to track all of your evaluations, and you have access to them at any point and at any time you want. Our Transitional Year program has incorporated the 6 core competencies as required by the ACGME. And if you're a DO, we have incorporated the 7th competency in osteopathic principles and practice. We will prepare you. Now, just like you're evaluated by your peers and attendings, this program is evaluated. The program is evaluated by faculty, but more importantly, it is evaluated by you. We cannot improve if we are not told what needs to be changed. Our residents evaluate us twice a year. In addition, we have 2 representatives at the GMEC which gives feedback. To give you an idea of some of the changes that were made because of evaluations of our interns, in 2012, we added an extra elective and removed the surgical requirement. In 2014, we revised the medicine rotation structure and added an extra resident to the ICU rotation. And in 2021, we changed the fact that there are no internal medicine rotations after an ICU rotation, and the last rotation of the year will be an elective. If you are an osteopathic medical student or an allopathic student who wishes to learn more about osteopathic principles and treatment, we are the place for you. We have a comprehensive educational program to continue your osteopathic education. Here at MCMC, the use of osteopathic principles and practice is felt to be good medicine. We encourage our DOs to continue the same principles they were taught in medical school and to include our allopathic colleagues and students as well. OMT is encouraged when appropriate, even if you're attending as an MD. Our curriculum has been designed to build upon the foundation your medical school provided you. Our goal is for you to use all the skills that you have learned and apply them to the bedside. In addition, we have put together a program that includes monthly conferences that adjust to current conditions. Our case conferences is an opportunity to learn how to apply OMT clinically both in the office as well as in the inpatient setting. We then break out into groups and practice the techniques you just learned. During the height of the pandemic, we transitioned to a journal club format. In this modality, we met online and discussed a recent article, dissected it, and reviewed the techniques presented. This year, the conferences combine the presentation of treatment modalities and include an article related to the presentation. Last year, we purchased a license for new OMT videos produced by an OMT practitioner that is available online. As we are a primary teaching site for PCOM, you will have the opportunity to mentor and teach future osteopathic physicians. You will be encouraged to perform OMT when appropriate, even in the ICU on mechanically ventilated patients. To assess your progress and to comply with an ACGME requirement, you will be assessed annually with an OMT and service examination. With all of the changes happening in the world today, our osteopathic education has also changed. Over the last year, we have learned how to use Microsoft Teams to present the lectures. However, this modality is now reserved for times when we can no longer meet in person. Even though we are not a university or a tertiary care facility, we do compensate fairly well. This year, the salary was around $63,000 with an educational stipend of $400. The stipend can be used for any educational purpose you wish, and this includes your Step 3 exam. Our medical malpractice insurance includes tail coverage, so you can be assured that we will protect you should you need it. Each intern gets 15 weekdays of vacation. You will spend approximately 80% of your time at Mercy Fitzgerald Hospital, 10% at Hupp Cedar, and 5% at PCOM. In addition, we offer online library for research and downloading the most recent literature. So why choose us for your TYR? Well, the slide says it all. You're not just a TYR. You will not be used only for SCUT. You will be treated as an equal to the categorical interns with the same responsibilities and the same patients. So you're going to be interviewing for a TYR position, but there is a bonus. This is actually a twofer. You're going to be interviewing for a preliminary position as well. However, the application is not for both. If you're interested in being considered for both a preliminary and TYR position, you need to apply to both of them through the ERIS. So what's the difference? Well, let me tell you. While both programs have interns that are going into advanced training in other fields, and both interns experience the same patient population, the TYR program has one more elective, and we require an ambulatory experience. That experience is an elective for preliminary interns who have more time on the inpatient side. Okay, so I discussed what we offer. Now you ask, why should you come here? Well, let me tell you. We support the reason you went to medical school in the first place. We believe that we offer a university quality and academically oriented medical and surgical service. We have dedicated and skilled faculty and have shown through a history of excellence in both ACGME and osteopathic training what we offer. We have unmasked disease pathology which is unique to the patients in our system. You will see things that only other people read about. In addition, we foster a team environment, and this is the future of medicine. While you're here for your internship, we also have a lot of opportunity for you to rest your mind and enjoy Philadelphia. The city has world-class dining, sports, entertainment, and shopping. In addition, we are not far from other large cities. For example, it is about an hour-and-a-half drive down to Baltimore, a 2-hour drive to New York City, and a 2.5-hour drive to Washington, D.C. In addition, Philadelphia offers a real depth of medical training facilities. If sports is not your thing, Philadelphia also has a lot of activities that will cater to you. We have the Franklin Institute of Science with its famous enlarged heart that you can actually walk through. If you are a theater buff, we have Broadway quality shows at the Walnut Street Theater. We have wonderful works of art at the Philadelphia Museum of Art. Those are the same steps that Rocky ran up in his movies, and you can run up them as well. In addition, we have Penn's Landing, which has its hammock park, and we have Fairmount Park, which is akin to Central Park up in New York. There's also the Philadelphia Zoo, and if you have children, there's the Please Touch Museum. Of course, there are other things to do outside of Philadelphia as well. Not far from Mercy Catholic Medical Center is Longwood Gardens, where you can walk through their fabulous and manicured gardens and arboretums that are on the grounds of the former DuPont family estate. In addition, you're approximately 1 hour away from the famous Jersey Shore, including Atlantic City and Wildwood. You're not that far from the Delaware beaches. In addition, with various holidays, you have Linvilla orchards to go apple and pumpkin picking, and if Halloween is your thing, there's always terror behind the walls. What I'm trying to say is that this area has a lot to offer. We will never ask you where you ranked us. It is not right and not allowed. But we will tell you if we think that you are a good fit. At the same time, if you think that we are not the place for you, please let us know. No hard feelings. We will also let you know if we do not think it would be a good match. If anything or any questions come up, please email or call us. I look forward to meeting you during the interview. Please ask any questions that you feel will help you make the right decision. There are no bad questions.